Hi, so I have a patient who is a 65-year-old female who is recently underwent an elective posterior total hip replacement on their left hip. She is currently day 2 post-op with pain level 4 out of 10. Complete your assessment, including a transfer patient from supine to chair with use of an imaginary walker. Briefly discuss educating on donning off donning socks.
Hi.
Hi, my name is Megan. I'm going to be your occupational therapist today. How are you doing?
Good.
How was your weekend?
Good.
Good. Now I'm going to move you from your bed to the chair so that you're more comfortable, and then you can watch some TV.
Okay.
Okay? So I'm going to have you bend this leg, and then this is your operated hip.
Yes.
Okay, perfect. So I'm going to have you scoot up the couch with your arms, just like that. Yep, just push. And then I'm going to help you move your leg down to the floor. And then you can move this leg down. Perfect. It looks like you're moving well. And I'm going to test your upper body strength by a quick screening. I'm just going to have you follow my motions.
Sure.
Okay? So I'm going to have you bring your arms up to the ceiling. I'm going to have you bring your arms to your head and then to your back. And I'm going to have you bring your arms to your shoulders, cross your arms, the same shoulders, back down, to the back, forward. And then I'm going to have you rotate your arms down, rotate your arms up, bring your wrist forward, bring your wrist back, and then neutral. And then I'm going to have you spread your fingers just like this, and then in. And then I'm going to have you bring your pinky to your thumb, and then the rest of your fingers, and then make a fist for me. Good. It looks like your range of motion in your upper extremity is really good.
Thank you.
So do you know your precautions for your hip?
No.
No? Okay. So I'm going to review them for you. So you cannot bend your hip 90 degrees, so like a right angle. And then you can't cross your legs. And then you can't bend your knee inward or outward.
Okay.
Because if you do, you will dislocate your hip, and you don't want that.
Okay.
So I'm going to assess your pain before I move you to the chair. This is called the Long Baker Face Pain Reading Scale. So can you rate your pain between a 0 to 10?
4.
Okay. So this means you're hurting a little bit more. So I'm going to have activities that are light so that we don't increase your pain level. Okay? So I'm going to put your gait belt on you. So this gait belt will help me make sure you don't fall when I transfer you to the chair. How is that? Is that tug?
That's great.
Is
Thank
it
you.
tight? Okay. So I'm going to bring this walker close to you. So when I transfer you, I'm going to have you push from your hands, and I'm going to grab on the back of you, and then you can start pushing down on your hands. Good. Perfect. How are you feeling? Are you feeling dizzy?
No, I'm good.
Okay. I'm going to have you take small little steps back towards the chair. And then I'm going to have you bring your arms back. Just imagine that there's an armrest. And I'm going to have you sit slowly and then bend your operated leg forward so you don't bend it. Good. How are you feeling?
Good.
Any dizziness? Okay. Let me just move this. Have you seen these adaptive equipment before?
Nope.
Okay. So when you have a hip operation, there's going to be a hip kit, it's called. So it comes with these adaptive equipment. So this is the sock aid. So this will help you put on your socks, which I will demonstrate later. And then this is a dressing stick. This will help you put on pants and help you with dressing. And then this is also a reacher. And then this you can also use putting off your socks and then reaching items from the floor.
Okay.
So all this will help you maintain your precautions.
Okay.
And also with the hip kit, you can get a long handled sponge to help with bathing. And then you can also get a shoe horn so that you can put on your shoes.
Okay, thank you.
Okay. So now I'm gonna demonstrate how to put on socks. So first, you're gonna fold up the sock just like this. And then you're gonna bend. This is a harder sock aid because it's like a foldable one. So you're gonna fold it up. You're gonna fold this. And then you're gonna put the sock on all the way. Just keep pushing it up. And that's about good. And then you're gonna bring the sock aid to the ground. And then you're gonna use these little handles. You're gonna put your foot into the sock aid. And you're gonna pull on these handles. Just keep pushing up until the sock is on your foot. And then to use the reacher, you're gonna grab on the edge of your sock and then you're gonna press this down and then you're gonna pull the sock down in order to take it off. Do you wanna try?
Sure.
Okay. So here's your sock aid and then here's your sock. It's better to use a sock aid that's more durable because this one's a foldable one. Good. You're doing great. Just keep rolling it up. I'm just gonna widen this a little bit so your foot goes in. Perfect. And you can place it on the ground. Good. Now you can put a sock on.
Thank you.
Can
That's
you
pretty easy.
take it off for me?
Sure.
Just so that you can try out the reacher. Yep, and then just pull down. Perfect. Good. Do you have any questions for me?
Nope.
I'm gonna give you a handout. So this is from my occupational therapy toolkit book. And I'm gonna give you this. And it shows images of how to take off a sock from a sock aid and how to remove the sock.
That is wonderful. Thank you so much, Megan.
You're welcome. And also, I'm gonna have you elevate the leg to reduce swelling, which I wrote on your handout. I'm gonna have you do that a couple times a day. Just put a pillow on the bed and then put your foot on it. And then also, I'm gonna have you do feet pumps 2 times an hour to prevent blood clots. Now I'm gonna show you how to do the foot pumps. All you have to do is just go up and down and just keep doing that in bed or when you're sitting down.
Okay.
Okay?
Mm-hmm.
And then there's that for you. I'm gonna grab your table and your phone and your call bell.
Okay, great.
Okay?
Thank you so much, Megan. I can't
You're
wait to see you
welcome.
tomorrow.
It was nice meeting you.
Nice to meet you too.